Hello, welcome to the final video in this week's video series about diabetes. So the first video I made was what is diabetes, then I have spoken about diabetic ketoacidosis and foods and drinks which can help to reverse diabetes or prevent diabetes and control your diabetes. Today I am going to specifically talk about reversing diabetes. Now, reversing diabetes is a term that usually refers to a significant long-term improvement in insulin sensitivity in people with type 2 diabetes. Now, people with type 2 diabetes that are able to get their HbA1c level below 42 without taking diabetes medication are said to have reversed their diabetes or resolved their diabetes. They also this is also known as putting diabetes into remission. The most common cause of type 2 diabetes is obesity-related lifestyle factors, which generally follows a vicious cycle pattern. Diets which are high in calories, particularly if those are calories which are refined carbohydrates, they cause insulin levels in the bloodstream to rise. So to cope with the high and quick acting carb intake, weight is gained generally around the central belly. Consistently high insulin levels lead to the body's cells becoming resistant to insulin and commonly lead to weight gain. High insulin levels also increase weight gain. Insulin resistance leads to an increase in blood sugar levels, particularly after meals. The pancreas produces more insulin to cope with this rising blood sugar levels due to the diet that you're eating. High sugar levels lead to feelings of feeling lethargic. High insulin levels lead to increased hunger. Then this vicious cycle becomes around again, and hunger often leads to overeating and even more lethargy. With less physical activity being taken, overeating, less activity and high insulin levels all lead to further weight gain and more insulin resistance. Can you see this vicious cycle? Consistently high demand on the pancreas to produce extra insulin leads to damage of the pancreas insulin producing beta cells. Beta cell damage results in the body struggling to produce enough insulin, and this results in even steeper rises in blood sugar levels, which can lead to more recognizable symptoms of diabetes. Such as you're always feeling thirsty, you're always feeling the need to urinate. So what do? To reverse diabetes, you need to be able to break this horrible cycle that I've just been speaking about, and to take the strain off insulin producing cells. How can we do that? Well, we need to do that with lifestyle factors. Obviously, exercise is one of them. However, research indicates that effective ways to reverse diabetes include low carbohydrate diets, very low carbohydrate diets, and as I just said, exercise. Low carbohydrate diets are known for lowering the amount of insulin the body needs to produce, resulting in less insulin resistance. Makes sense. A study published, I think it's in 2014, by a university in Naples. Now, the name of the university does escape me at the moment. Showed that a low carbohydrate Mediterranean style diet was able to achieve significant rates of remission in people with type 2 diabetes. After just 1 year following the diet, 15% of participants achieved remission, which is brilliant. And after 6 years, 5% had achieved remission on that diet. So a further 5%, which is a stunning achievement, isn't it? By comparison, a low-fat diet were not as effective. There was a study done where after 1 year, I think only 4% of participants on a low-fat diet had achieved remission. And after 6 years, this was zero. So it's not the low-fat diet, it's the low-carbohydrate diet that can help achieve remission from diabetes. Now, something that I'm a great advocate of is intermittent fasting. Intermittent fasting is when you go through periods of the day when you're not eating. For me personally, I don't eat breakfast. I have lunch about 1 o'clock, and my last meal in the evening is 7:30. And I feel that intermittent fasting has its place in trying to reverse diabetes. However, this needs to be planned intermittent fasting. Now, planned intermittent fasting may help to reverse diabetes. There's been a couple of studies that were sent into the BMJ case study reports by 3 doctors, and after they spoke about 3 patients who were in their care, who was able to cut out the need for insulin treatment altogether. 3 men aged between 40 and 67 from the top of my mind tried out planned intermittent fasting to see if it might ease their symptoms. They were taking various drugs to control their diseases, as well as daily units of insulin. In addition to type 2 diabetes, they all had high blood pressure too, and high cholesterol levels. And I often find that with some of my diabetic patients, they also have high blood pressure. 2 of the men fasted on alternate days for a full 24 hours, while the third fasted for 3 days a week. On fast days, they were allowed to drink very low calorie drinks, such as tea and coffee without sugar, or water, and they were able to eat 1 very low calorie meal in the evening. Now, before embarking on their fasting regime, they were all attended a 6-hour long nutritional training seminar, which I think is really important for the patient to understand about nutrition, which included information on how diabetes develops and its impact on the body, insulin resistance, healthy eating, and how to manage diabetes through diet, including therapeutic fasting. So the patient needs to buy into the process. You can't just tell the patient that you need to start fasting. Now, they stuck to this for a pattern for around 10 months, after which fasting blood glucose, average blood HbA1c, weight and waist circumference was remeasured. All 3 men were able to stop injecting themselves with insulin, which I think is great. Within a month of starting their fasting schedule. Now, in one case, this took only 5 days. 2 of the men were able to stop taking all of their diabetic drugs, while a third discontinued 3 out of the 4 drugs he was taking. They all lost weight, I think about 10 to 18 or 20%, as well as reducing their fasting blood glucose readings, which may help lower the risk of future complications. This was reported by the 3 doctors that presented these case studies. Feedback was really positive with all 3 men, and they managed to stick to their dietary schedule without too much difficulty. Now, these are observational studies, and they just refer to 3 case studies. So you can't really use this as a great beacon of evidence that all diabetics should be starting to fast. As such, it isn't possible to really draw massive conclusions to the wider success or otherwise of this type of approach for type 2 diabetes. However, I feel that rather than fasting for 24 hours, it may be beneficial to do shorter intermittent fasting periods, even if it's for 5 to 6 hours. However, before you try anything of this, anything like this, go and visit your GP, who may put you in touch with a nutritionalist, and you'll need a lot more advice. Please don't watch my video and start fasting like this. However, you can reverse your type 2 diabetes. You can definitely reverse your type 2 diabetes. It requires a consistent energy and focus that you place on achieving this task. Hope you found this video interesting, and I shall speak to you soon. Take care. Bye.